Hello, everyone. I'm happy to be here. My name is Joanna Hildebrand. I am the Director of Vendor Management here at the Hospital for Special Surgery. I've been in healthcare supply chain for more than 15 years. I won't tell you exactly how many because that would age myself. I've been in strategic sourcing, procurement, vendor management roles. Currently, today, I lead an enterprise-wide program overseeing over 2,500 vendors here at HSS. Just to give you an idea, HSS is nationally ranked, if you don't know, as the #1 orthopedics institute, performing over 30,000 surgeries annually. So as you can imagine, that means we have a lot of support from our vendor representatives. So back in 2022, HSS identified the need to establish a vendor management program, which is why I'm here speaking to you today. I'll be talking about our journey, and I hope you leave inspired and find this information helpful as you navigate your vendor management world. So the first thing I'll do, I'll rewind back to 2022 when I entered the role to set the stage and tell you what vendor management looked like when I joined. Then I'll discuss the steps we took to begin building out vendor management as a more strategic function. And then I'll take you through the steps of building out a great foundation for a program. We'll talk about some lessons we learned along the way. And then what are we doing today? How are we collaborating with Green Security? And end with some key takeaways. Let's set the stage. It's 2022. Vendor management was a newly created team, new leader. I had to come in and understand the landscape. The first few months was really a lot of information gathering. What we did have in place was simpler. We did move forward from there. We had our OR clinical vendors in the system at the very least. There was no real monitoring to ensure the vendors were checking in. We did see some check-ins in the system, but when I did some walkthroughs of the OR, I saw a lot of those red bouffant caps. The numbers weren't aligning. There was a lot more vendors on site than I thought there were. So I knew I had a lot of work ahead of me. Next step was to really focus on compliance in Green Security. Needed to understand, are we meeting at a minimum the requirements by surveyors? I do have a great Joint Commission story. So when we did establish the program, we had some questions about specific reps. What was great about having Green Security was that I could just pull up Green Security and show them I have this document available to me in their credentials. Everything went very seamlessly. I didn't have to search for documents. It was very helpful, and I'm glad we have that in place today. Then, in order to build a program, we had to identify really where were our gaps. How do we identify what vendors are on site today? Because like I said, we were only looking at our clinical vendors, right? So there are so many more vendors coming on site at healthcare institutions across the board. There's IT vendors, there's consultants, there's food vendors. So I really need to understand that population. And I didn't have a system or a way to communicate with these vendors. So what I did was we had to partner with our internal stakeholders to identify these people and then start categorizing them and then go about building the program. And then finally, one key thing to start building the program was to establish key partnerships. So compliance, security, and supply chain really partnered to build this program. Security was there for that on-site enforcement, that boots on the ground. And then compliance was there with their expertise on security and regulatory requirements. So now reframing vendor management as a strategic function. This was important because we didn't want to start off a new program saying, we're just policing our vendors, because that's not what vendor management is, right? There were so many misconceptions we saw from the get-go. There was, it's just badge management, it's a security project or supply chain admin function. But really, vendor management is about reducing the operational risk to ultimately enable, quality patient care. So to move beyond that mentality, what we had to do was really frame vendor management around safety of not only our patients, our visitors, our staff, but also our vendors. It's important to treat them as our employees as well. So ultimately, if we went with that in mind through everything we did, we set that up as, this is working collaboratively to build out those strong partnerships. Building the program. The first thing was building out that governance. And I liked something that Nikki said at the opening, that vendor management really is about ownership, clear ownership. And that's what we were able to do here at HSS, establish vendor management as the owner of the program from building, enforcing, and maintaining. Obviously, with the help of so many internal departments, but that was clear from the get-go. And then we had to establish clear vendor policies. This was so important because when I came on board, I remember nurses coming up to me saying, "Hey, oh, I'm glad you're here. I have some stories about what vendors are doing at the institution. I have some complaints here and there." And it was overwhelming. But I think what we had to step back and was look at, hey, did we ever give them guidelines? Did we ever set policies, state what they couldn't do? And that wasn't necessarily in place. So the first thing we need to do was establish those clear policies, obviously reasonable and enforceable. That was one of the first steps that we had to take to really sit down, understand what guidelines do we need to provide. And then we started building out our credentials in green security. The next thing was centralizing vendor communication. So we set up one email address for not only intake of any vendor requests externally, but also to share information across like internal stakeholders and the vendor population. And then finally, we built a website, both an intranet site and an external site to provide vendors with just access to information, an easy place for them to understand what are our workflows, where can I find this information. So the next step, governance set, strong policies in place. We've got the buy-in, set up relationships. So we went into this program with the vendor partnership mentality. And I think that is so important because it isn't about us versus them. We wanted to let vendors know that, like, while we're trying to improve workflows for our institution and our staff, it was also, we wanted to make it apparent that it was the vendor reps were important as well. They were a necessity to our ongoing operations. So we worked with multiple departments, internal stakeholders to really set up those relationships and make sure everyone understood these are our partners, we're working with them, and that we wanted all of that visibility. And next, the risk and safety, access controls. I think the last session talked a little bit about door badge access. This is an important piece to our program. And one thing we had to do was, so there were a lot of vendors that had legacy badges and had free reign to the institution. We needed better control around that. So we did a reset. We started controlling it better. One requirement was you have to be in green security in order to have door badge access. And then we could police it better. Next, in order to build out the program and get buy-in across the board, and like I said, we had vendors coming in. We didn't know who was on site at all times. So we created one entrance. Obviously, hospitals have so many doors you can enter, but we made one unified vendor entrance. So when a vendor tried to enter through a door, security was there to stop them, reroute them to the vendor entrance. And at that point, if that vendor wasn't in green security, we would hand them a pamphlet, communicate to them what our program was, because we didn't even have their email at that point. So this allowed us to grow the program very quickly. And then from there, we started monitoring the violations, monitoring vendor guest check-ins and things like that. And then finally, operations, standardizing the workflows. So what we had to do was we looked at the different workflows within an institution that vendors touch. So loaner management, tray management, where are they storing their products? And we started standardizing the process, communicating it, and that helped really build out our program. Some stats now that we've established a program. We've been here for over 3 years with green security. We have 2,667 active vendor representatives that come on site on a daily basis, and that number continues to grow. We have 15 locations with iPad check-in kiosks. At the main hospital, we do have a computer at the main vendor entrance. And then at the main hospital, we have about 100 check-ins on a daily basis. Some lessons learned along the way. And I did hit on some of these points earlier, but there will be significant internal and external pushback. There will be departments that say, well, my vendors are out of scope, or for varying reasons, because there is a fee to green security, there are going to be some departments that will push back. I think it's important that you have that leadership buy-in so that you can push your program and really help internal stakeholders understand this isn't a roadblock. It's to ensure the safety within the institution. The next thing is train more than you think you need to. Everyone that touches the program, it's important that they have clear, concise information. Simple one-page guidelines, for example, were so helpful at the security podiums where if this happens, this is what I should do. Or if there's a vendor that comes in trying to get into the OR, they don't have access to green security, we can revert them to the vendor management team. So we get calls on a daily basis asking, hey, can I let this person in? And that constant communication is so helpful. Constant monitoring of the violations is important because you could build a great program. If you're not maintaining or monitoring it, it's going to fall apart, right? So you have to constantly check in. How many people are approved versus pending? What do your vendor guest check-ins look like? Because a lot of people try to get away with so many vendor guest check-ins, and obviously there's a limit. Strong policies. I think I've said this several times already. They are so important because anytime a vendor comes in and there's an issue or they're non-compliant, you have those policies to turn back to. And if then you go into the green security system and you can see the actual dates they attest to, and we found that so successful when we have a vendor issue, you can follow through with that escalation. And once you do, word gets around that, hey, vendor management serious, I got suspended for doing this. I think it's so helpful. Communication. So internal and external, any ways you can communicate is so important. You can't over communicate the program. So we are using different avenues, right? Our internal and external website. We have that centralized email address. We're communicating via green security, via our email addresses. We have posters around, we have handouts, and really just being transparent about the program is helpful. And then finally, be open to change. If something isn't working, explore the possibility of, rerouting. Think about possible integrations with all of this technology coming on board, building out dashboards. There's so much work for us to do, even though we have a great program in place. So I think being open is important. Okay, the future, where we're headed and what we're doing in collaboration with green security today. So I said that we had one main vendor entrance at the main hospital. We've opened more kiosks at different doors across the institution because now vendors need quick access to the institution. Now that we have an established program, we'll put iPad kiosks at different doors so vendors can quickly check in. We still do have security at those doors. So if someone doesn't have a green security badge, they can reroute them back to that vendor entrance. Now, regarding door badge access. So today, if a vendor needs access to some doors around the institution, they badge for checking in, and then HSS vendor badge for specific doors. As you can imagine, it's a manual process to remove that access if someone's non-compliant, which leads me to my next. What we're trying to do is automatically deactivating those badges when they have that X in green security and they're non-compliant. So that's the next step in our automation plan, is to deactivate anyone's badges when they're non-compliant or if there's a suspension or something like that. So today we're still using those HSS vendor badges, but the plan is to move to the RFID badges in future. Now, in terms of cybersecurity, obviously that's a big topic of conversation. We are in our next phase, we are moving to requiring all remote vendors to credential in green security. Now, once we do that, that opens the doors. We have different set of credentials for this subset, but I think it's helpful because this allows us to share and educate the vendor population that is accessing remotely. And then finally, we have quarterly business reviews that we're setting up with our strategic suppliers. We are building out dashboards in green security to incorporate into our performance metrics to really understand holistically, okay, yeah, you have on-time deliveries, but then your support on site. This many people are coming in on a daily basis, but they're not fully credentialed. So this allows us to work better with our vendor partners. Few key takeaways. I know that was a lot of information and I went a little bit fast, but build strong, concise, enforceable policies. I can't reiterate this enough. We're constantly looking at our policies and how we can improve them. Communicate, use several different forms of communication if you can. The websites, email notifications, posters, handouts, they're all very helpful because everyone receives information differently. And then finally, vendor management isn't about controlling or restricting access to hospitals. It's really about enabling safer, smarter operations through collaboration and better partnership with our vendors.